MMT Elbow flexion, biceps, brachialis, and brachioradialis. Assist the patient to the short sitting position with the arms at the sides. Make sure the patient's feet rest on the floor or on a stool. There will be 3 different test positions for the 3 muscles that perform elbow flexion. For the biceps brachii, the forearm is positioned in supination. For the brachialis, the forearm is positioned in pronation. For the brachioradialis, the forearm is positioned midway between pronation and supination so that the thumb is pointing toward the ceiling. Stand in front of the patient on the test side. Passively flex the patient's elbow in all 3 test positions. The shoulder should be slightly flexed. Stabilize the patient at the shoulder as you support the forearm proximal to the wrist. You are not assessing the end feel. You are determining how much range the patient is able to move the elbow in this direction so that you can appropriately assign a muscle grade. Stabilize the patient at the shoulder to prevent trunk from flexing. The shoulder will be slightly flexed. In patient-appropriate language, ask the patient to flex the elbow with the forearm in all 3 positions. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include shoulder flexion to bring the arm to a more gravity-eliminated position and any motion that is out of the sagittal plane. During the biceps brachii test, the patient may attempt to bring the forearm out of supination. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the shoulder to provide a counterforce to your resistance. Place your other hand over the forearm just proximal to the wrist and apply the resistance in a downward direction. The resistance is applied in a direction toward elbow extension. Perform the test with the forearm in all 3 previously described positions. Apply the force for a 5-second count. You will assign a separate grade for all 3 muscles being tested. Grade 5, normal. The patient completes full range of motion in elbow flexion and holds against maximum resistance. Grade 4, good. The patient completes full range of motion in elbow flexion but breaks against strong to moderate resistance. For grade 3, there is no resistance applied. Instead, support the arm at the elbow with a cupped hand. Grade 3, fair. The patient completes full range of motion in elbow flexion but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Keep the patient in the short sitting position. Abduct the patient's arm to 90 degrees and support the weight of the arm. You will still need to perform the test for all 3 forearm positions. The gravity-eliminated therapist position is to stand in front of the patient, support the abducted arm under the elbow and wrist if necessary, and make sure that you do not resist or assist with elbow flexion. Instruct the patient to attempt elbow flexion. You need to observe for any extraneous movements of the arm. Just as before, you will grade each muscle separately. Grade 2, poor. The patient completes full range of motion in elbow flexion. For grade 1, you must reposition the patient to the supine position. Stand at the test side. Palpate the tendon of the biceps in the antecubital space. Palpate the brachialis in the distal arm medial to the tendon of the biceps. Palpate the brachioradialis on the proximal volar surface of the forearm where it forms the lateral border of the cubital fossa. Grade 1, trace, palpable contractile activity with no motion. Grade 0, no palpable contraction.